Hi, and welcome back to Girl Talk. We are filming today at Bella Domicile. Later in the show, we're going to talk about a really important give-back effort called Design for a Difference, and I'm excited to learn more about what they're doing this year. Right now, whether you like it or not, it's back to school time, so we're going to give you some important tips regarding dental care. And joining us is Dr. Angela Cotey with Village Smile Care, and we've become friendly over the break, so it's Angie. How are you?
Hi, good, how are you?
Good, so glad to have you. Thanks for being here.
Thanks for having me.
So obviously a good time to establish a good daily routine and a routine in general for general dental care. So what are some dental tips for parents who are preparing for back to school?
Yeah, I think summer can be kind of a fun time, but also you get out of your routine, so it's really a good time to reestablish that good routine of brushing twice a day and flossing. An important tip for parents is if your child cannot tie their own shoes, you should be brushing for them or helping them brush.
That's a great guideline, okay.
Yeah. Otherwise, they just don't have the dexterity to reach the back teeth and do a good job. Also with back to school, a lot of kids are starting sports. You'll see the football teams practicing, and it just is a good reminder to consider a custom mouth guard for your child if they're going to be playing any sports this year.
Oh, interesting, okay.
I'm chuckling, Angie, because one of my favorite sayings is, you only need to brush and floss the ones you want to keep.
Very true, I love that saying. Yeah.
Maybe tell kids that.
Yeah.
Talking about the mouth guards, you and I were talking a little bit earlier that you can get sort of the standard issue mouth guard, or you can have a custom one made by a dentist. What's the difference between the two?
Yeah, I think any mouth guard is great, and just wearing one's very important. So if the only access the kid has is to a stock guard given at school, that's great. They should wear it. Custom mouth guard is going to be a little more comfortable. It's going to fit tighter to the teeth, fit around their teeth. So during an injury, it could be a little more protective, but also it's not going to rub the gums or be loose and fall out. So it can give more protection and just be easier for the kid to wear.
I'm just thinking too, probably more likely for them then to wear it when you're not there.
Yeah, we can do fun colors, so they're really great.
Oh, I was thinking the same thing.
Yeah.
Absolutely.
Colors always help convince kids to do what you'd like them to do, right? So what kinds of activities would you want to provide a mouth guard for your child for in school?
Well, the obvious are the contact sports, and a lot of times it's required for football or hockey and basketball.
Hockey came to mind right away.
Yeah, definitely very important. But you don't want to forget the sports where maybe it's not contact, but things can still happen, like volleyball, lacrosse, even gymnastics and skiing. I had a 13-year-old patient lose 2 front teeth snowboarding just from falling. So anything where a child could incidentally get elbowed or hit in the face or fall and bump their teeth, it's really important to wear protection.
Yeah, absolutely. I mean, any activity that you're doing as a child, you're going all in. So you probably could get bonked in the head with a ball, or I mean, who knows, whatever sport it is, volleyball, etc.
Yeah.
Good point.
And now if you forgot to follow Dr. Angie's advice and you do have an injury to your teeth, what do you do?
So if it's a baby tooth, so usually kids around 6 and under, most teeth are baby teeth, then it's not as critical. But any adult tooth, if it chips or breaks, time is not that critical. But if a whole tooth comes out and you can see the root, it's really important to get to a dentist as soon as you can, within 30 minutes to an hour if you can. And there's a lot of misconceptions on what to do with that tooth. The part that you would see in your mouth, the really white part, the crown, you only want to touch that part. And if you can put it back in, even if it's backwards or not all the way, that's going to be the best.
Really?
Just for the cells of the tooth. Sounds kind of scary. So if you can't do that, even keeping it in the mouth, like in your cheek, for an older child, if it's a younger child and they might swallow it, you can have them spit in a cup. The saliva is really the best. You want to avoid tap water or bottled water. That will really actually kill the cells faster.
Oh, wow, because that would be my instinct, would maybe to
keep
put
it
in a
moist.
little water, right?
Yeah,
So
or some people will scrub it and brush it and wash it, and you don't want to do that either. So
Interesting.
Angie, we just have like 30 seconds or so left. Do you have other resources you can recommend to viewers that are parents?
Yeah, the American Dental Association has a great website. We have little brochures we give out in our office that have tons of tips for parents, but ada.org has lots of great tips, or just checking with your dentist. But if you have an emergency, always just call your dentist first.
Wow, thank you so much. Again, this is Dr. Angela Cotey with Village Smile Care. Great tips for your teeth. We'll be back. We have more Girl Talk coming up here at Bella Domicile after this.